Hi, my name is Joe Parker. I'm the Director of Home Health Services here at Palomar Health, and I have type 2 diabetes. Here at Home Health, we help to take care of patients in the home setting once they're discharged from the hospital and allow the patient to receive care in the freedom of their own home. So specifically with my team, what I do is I help to set the vision, and I work with a great group of leaders to help work with the staff and support the staff. So type 2 diabetes is a disease process in which the body cannot handle or produce enough insulin. What ends up happening is you can have high levels of glucose circulating in the bloodstream as well as the urine. Some of the symptoms that you can experience with type 2 diabetes are elevated blood sugars, and that's if you're monitoring those. Oftentimes some people will have increased thirst. They'll have increased need to have to use the restroom. And for type 2 diabetes, you can actually, for some people, they can have increased weight gain as well. So I was diagnosed with type 2 diabetes 2 years ago on an annual health screening. So here at Palomar Health, at that time we were doing screenings for people with for lipid levels as well as blood glucose, and my blood glucose was elevated. So I did follow up with my primary care physician, and then that's when I was diagnosed with type 2 diabetes. Both my mom and my dad are both type 2 diabetics. I have a long family history on my mom's side of type 2 diabetes as well. A challenging day would be when I have a lot of meetings and so forth scheduled, or life becomes hectic. Sometimes, occasionally, can forget to take your medication. And so for me is when it becomes very hectic, is when I can't take my medications or I'm not able to eat properly. Every day is a challenge, and it's one day at a time. I help to make sure that I take my medications in the morning, have a pill box system I take in the morning and the evening, as well as trying to make good choices when I'm eating. And that is a day by day, a meal by meal struggle. But how do you eat foods that are more nutritious and have value add, as opposed to those things that would complicate my diabetes. For me, exercise is extremely important when you have diabetes. It helps to regulate your glucose need, right? Your body's need. And I enjoy outdoor activities with my family. We go kayaking, we go hiking, and so it helps us and helps me in order to stay active. The intrigue for me with hiking is be able to go into nature and be able to see the scenery as well as get the physical exercise. So the biggest advice that I have for someone who has type 2 diabetes is to understand that it is a life change. How does taking your medications, eating correctly, getting activity, how does all that come into play? And how can you do that day by day and do better each day?